What muscles do I train for what grip? That's a big question, so I'm going to break it down into understandable chunks. Hand strength is the foundation of all climbing performance. In order to train the hand properly, we need to know how it works. Hand anatomy is the most complex musculoskeletal anatomy in the human body. To help keep things simple but accurate, I've recruited a world-class expert to help. In order to deeply understand something, there is no substitute for practical experience. To understand hand anatomy, that means cutting open the hand and looking inside. If you aren't doing this on a regular basis, you'll never have the deep appreciation of somebody who is. My questionable credentials are a MD degree, 15 years in the operating room, 20 years of rock climbing experience, and autism spectrum disorder. Because I'm on shaky ground here, I've recruited an actual expert to help with the discussion. Dr. Wheelock is a practicing plastic surgeon with 15 years experience in hand surgery and a subspecialty practice in pediatric congenital hand abnormalities. She surgically creates hands for children born with hand differences. This is the most complex kind of handwork in the world, a real hand expert. Dr. Wheelock, welcome to the YouTube channel.
Thanks for having me.
It's safe to say that you've actually handled and interacted with everything we're going to talk about here today.
Yeah, I mean, pun aside, having a deep understanding of the anatomy, but also the functional anatomy is really important in helping to get your climbing training to the next level.
So the plan today is to discuss every type of climbing hold, the functional hand anatomy related to that, and how to train it for optimal strength. You can use this information to structure a training program, diagnose weaknesses, and get those sweet early gains. A proper understanding avoids training overlap. In the grip sport world, they don't understand hand anatomy and they commonly compete or train overlapping events. The analogy would be a bodybuilder doing 8 different exercises to isolate biceps. You will get gains this way, but it is inefficient for optimal progress. Before we jump into the holds, a little bit of background knowledge for baseline. First, the terms that we're going to use. When it comes to discussing the anatomy in a professional setting, does anybody use the Latin medical names?
No, we just use acronyms. The Latin names are far too cumbersome.
Right, so most muscles have either a short form or a 3-letter acronym, and that's what the professionals use when discussing this. So we're going to stick to that. So to start, when it comes to the functional grouping of muscles for rock climbing, there are 2 main categories.
Yeah, so there's 2 main categories that we often use. The first is extrinsic muscles and the second is intrinsic. So extrinsic are the large muscles that live in your forearm and then have tendons that extend up to the hand. Intrinsic muscles are inside the hand, and these are small muscles that are within the hand themselves. But don't sleep on them just because they're small. They really contribute to your overall hand function.
So let's work our way from the elbow to the fingertip and discuss the main functional groupings of the muscles and what that they do.
We'll start first with the wrist flexors. There's 2 flexors of the wrist, and they again start in the forearm and come down and attach at the wrist, and these help bend your hand at the wrist. From there, we'll move on to the finger flexors. There's 2 main flexors of the fingers. The first is the FDS tendon and muscle belly. This again starts in the forearm, goes across the wrist, and up to bend the middle joint on your fingers.
What do we have next?
And then finally, we have the FDP tendon. The FDP tendon, again, starts in a similar area, starts in the forearm, it extends across the wrist and down to the furthest joint of the finger. This one we often think of as just bending the tip of the finger. However, it does act to bend both the middle joint and the furthest joint.
So we're working our way up. We've covered wrist flexors, both finger flexors, middle joint, end joint.
Can't forget the thumb.
Thumb catches are my favorite style of climbing hold.
So the extrinsic thumb flexor is FPL. Again, it starts in the forearm. On this side of the forearm, comes across the wrist, and then to bend the middle joint of the thumb.
Okay, so to recap, we have 4 main groups of muscles in the forearm itself. The first flexes the wrist, the second flexes the fingers at the middle joint, the third closes the fingers completely, pulling at the end of the fingertip, and then finally we have the thumb FPL, the thumb tendon that does this. So we've covered the muscles of the forearm, the extrinsic muscles, which just means outside of the hand. Let's do the inside of the hand or intrinsic muscles next.
Right, and this is where it really gets complicated in some areas. So again, we're going to focus very much on groupings that impact the movement that you're going to use for climbing. And so we're going to focus on three main movements. The first is thumb adduction. This means bringing your thumb in towards the hand. And when this is in play, you can see that the muscle in between your thumb and your hand will be firm and bulky.
Like gripping a piece of paper with the side of your hand like this.
From there, staying on the thumb, we'll move down to the base of the thumb, to the thick, meaty wad at the base of your thumb, and those we'll call the thenar. This is a group of muscles that helps flex your thumb again and bring it across the hand.
So thumb across the hand towards pinky, and then finally?
And then finally are the intrinsic finger flexors. So this is a group of small muscles that actually start from your extrinsic tendons and work to bend these knuckles here.
So this is a pretty cool group of muscles. They actually live attached to the large finger flexors of the forearm, but they specifically do that motion?
Yeah, that's it.
Yeah. Okay, great. So not bad. We've got four functional muscles in the forearm and three functional groupings of muscles in the hands. And to recap the hand muscles, we have thumb towards fingers, thumb towards pinky, and then finally fingers flexed at the very first joint. Now that we've covered the basics of hand anatomy, we are going to make it relevant to specific climbing grip types. When it comes to functional hand strength, it's always going to be a combination of muscles working together.
Yeah, and that's why we didn't focus on like all of the individual muscles, but really on the movements to try and specifically look at the movements that you want to target in your training.
What we're seeking to do is identify the main limiting factor that's contributing to your performance, but that's also causing you to fail so that you can target that and make gains in your climbing. We're going to go from anatomically simplest grip to anatomically most complex grip. We're going to start with the anatomically simplest grip, the open hand crimp. So on the wall here, we have a hold on my project that I use as an open hand crimp, where I'm flexing just the ends of the fingers.
Well, I think this is a great example of FDP being the predominant muscle group used.
For the open hand crimp, there's basically one very important muscle group that you're going to want to train, and that is the FDP, that flexes those distal fingertips. There are a couple of interesting variations on the open hand crimp. For example, two-finger pockets, and there's some interesting anatomy involved in pocket climbing.
Yeah, well, so the FDP muscle belly tends to be a common muscle belly, which means it's one muscle belly for all of the tendons. This means that you can't engage just one or two fingers, but you need to pull through the distal, the furthest joint of all fingers at the same time in order to have maximum strength.
So that's why when you are climbing pockets, the fingers not in use will be curled up. The FDP requires all four tendons to be pulling at the same time.
Yeah, and you can test this on yourself as you watch this video to see the phenomenon.
Because of this anatomical fact, when you're training FDP, you want to use holds that engage all four fingers at the same time. When it comes to pocket training, you want to practice pockets for skill, but you don't want to train to failure. It doesn't optimally load the muscle belly, and it's definitely going to have a higher injury potential.
Well, this is a great Easter egg for your next video.
The next subtype of open hand crimp is the coarse crystal sloper hold. What we commonly call slopers in Nova Scotia are actually open hand crimps from an anatomical point of view. They require digging with the distal fingertips and are FDP predominant. In the old days, when people got strong climbing outdoors before the popularity of climbing gyms, Nova Scotia climbers used to underperform on actual slopers or indoor slopers. These days, people predominantly climb indoors, and the situation has reversed. Gym climbers often complain about sandbag grades in Nova Scotia. This is almost exclusively on sloper lines. Classic examples are Grizzly or Exciter Sit. If you find them hard, your sloper strength is coming from gym climbing. The mind-blowing fact here is that contrary to your lying eyes, these lines are crimp lines, not sloper lines, from an anatomical point of view. They can be climbed as sloper lines, but this dramatically increases the difficulty and is responsible for the grading disconnect. If you crimp your way up Grizzly, you will be soon suggesting a downgrade. This is why Jen, who is primarily an outdoor climber, is obsessed with crystals. She's crimping her way up these climbs, not using slopers from an anatomical point of view. There's a great example on my project here, the sit down to the arête, where on this hold, when I come around the arête, it looks like a sloper, but this is 100% a FDP based crimp.
Yeah, you can see that this joint here is curling as you come to grip it more firmly.
So I'm engaging with that distal fingertip, and that makes it an open hand crimp, not a sloper from an anatomical point of view. The last variant of open hand crimp is actually thumb catches. When you are using these Nova Scotia slopers or open hand crimps, you're almost always also looking for a thumb catch.
So again, this comes back to our FPL tendon, the extrinsic tendon that flexes your thumb that lives in the forearm.
So the thumb catches are essentially open hand crimp for the thumb, directly analogous.
You know, I think the fact that you call it an open hand crimp tells you that it has nothing to do with the hand intrinsics, because your hand is open and flat. Therefore, it has to be those large muscles from your forearms that are helping bend these joints further down on the fingers.
Next up, we're going to talk about the close-handed crimp and how that differs anatomically. On my project here, there is a smaller ledge that I grasp in the close-handed fashion like this, where you start curling the hand. So how does the hand function change as we start closing?
Well, I think this comes back to what you were saying before, where it's groups of muscles, right? But as you demonstrated that, you can see that you're still using your FDP tendon, but you're actually going to start recruiting your FDS, as well as some hand intrinsics to give you some bend or some flexion at this joint here.
Right, so to get strong at close-handed crimps, you're going to add FDS to the training and some hand intrinsic work as well. The close-handed crimp is a much more difficult training goal because it starts getting a little bit more complex and it's harder to isolate the variables.
If you focus solely on the open hand, what will happen is when you're forced into this closed hand, you're going to find that you try and compensate by going back to the open, but you're leaving a bunch of beginner gains on the table where you could increase your strength by working on some of these other muscle groups too.
And in kids with hand differences, you see this, where they come in and they may have lost the function completely of a certain muscle group and they find ingenious ways to work around it.
Yeah, it's really neat how we can compensate, but that doesn't get away from trying to target your training in the most aggressive way you can.
And you see this in climbing all the time. People become either open hand or close hand crimp specialists. And that's because one muscle group is predominating, and so it just always gets the training stimulus and just always stays ahead of the other. And so you'll forever get in a cycle of favoring one muscle group versus another. But sometimes you'll hit a line where it forces the hold, and then you're in trouble.
Yeah, and certainly I think, being aware of what you're favoring with your training and trying to focus on the other is, again, just going to help you get some of those early gains that can drive your training further forward.
We're going to move on to more complex hold types. The most basic type of sloper is the smooth open-handed sloper. In Nova Scotia, we have very few actual slopers, so I won't be able to find an example to demonstrate anywhere in this climbing area. Climbers who climb primarily outdoors in Nova Scotia have historically done poorly on sandstone slopers or Waco patina, where there's no texture and they can't use that open hand crimp to compensate. So when it comes to the open hand sloper, we'll pretend that I have one here, and you place your hand on the rock and you're applying friction through the entire finger and hand. So what are we going to use from an anatomical point of view to accomplish that?
Well, I think the big addition here, and you're kind of demonstrating it nicely, is the wrist flexion and how that starts to become very important in helping apply force to the rock.
So wrist flexors, and what about the hand intrinsics?
Yeah, I mean, you can't ignore them. I think that's coming into, you're trying to bend and to cup the rock using these intrinsics here to do that.
Right, and the finger flexors are still engaged, but if you lack the ability to flex at the wrist and bend with the hand intrinsics, you'll be a lot weaker than otherwise. In order to train for the slopers that we don't have in Nova Scotia, you'll want to be hitting the wrist flexion and the finger flexion at that first joint.
I think that goes for indoor climbers. Gym climbers really might want to focus on those groups too to help them excel in the gym.
Right, and so that's a point. There's a special situation with the large gym sloper that you simply don't see outdoors, and that is the gym sloper where you can start wrapping the sloper, coming around it like this. And how does that change the function?
Well, this is really interesting, and I think you're helping demonstrate this here, but you can also try this at home. As your wrist flexes, your extrinsic finger flexors are less effective, so you're losing strength of grip through these fingers, and so you're really going to rely on your hand intrinsics to help grip.
Right. So what you're saying is that as I do this, I can't grip as strongly something in my fingers, and you can just grab your own hand or anything and do that, and you can sort of feel when your wrist flexes, I'm unable to grasp.
Right, versus when it's extended. So try in both positions and you'll really be able to see that difference.
So when it's extended, I can grasp strongly, and when I'm like this, I can't hold it at all. You see these kinds of holds in the gym more than anywhere, where you're really wrapping and cupping the hold, and so for that you want very strong wrists and finger, and you can still use those hand intrinsics.
Right.
So it becomes a two muscle group hold at that point. So to recap, we have covered open hand crimp and all of its variants and related grip types, close-handed crimp, slopers, and gym slopers.
Right.
We're moving on to the next hold type, pinches. There are two predominant kinds of pinches in rock climbing, wide pinches and narrow pinches, and then endless variations in between. But the core pinch types, the wide pinch and the narrow pinch, we'll start with wide pinch. We don't have pinches in Nova Scotia. There are so few pinch holds that it's almost not worth training if you primarily climb outdoors in Nova Scotia. Gym climbers, however, literally everything is a pinch because they protrude from the wall. Because we don't have pinches, we're going to use this log. Okay, so we've got a pinch. Let's talk.
Well, I think what you can see here, or maybe it's hard to see because it's such a small muscle, but your adductor, so the muscle that sits in here, is really on firing here. It's firm, it's hard, and that's bringing that thumb in towards the hand in the pinch.
Right. So bringing thumb towards finger is adductor. It's the tiny muscle in between the thumb and the first finger. And that is predominantly important for the wide pinch. Now, the other side of the wide pinch are the fingers. What do they do?
Well, you have your hand intrinsics again. So we said that they're important, and they're back. Flexing your fingers at that first joint.
Okay, so wide pinches, you want strong adductor, and you want hand intrinsics. Narrow pinches present a different situation, where you're grasping something like this. This is a less common climbing hold type, but it's still important nonetheless.
Yeah, and I think it's hard to appreciate here, but the thumb is now coming across the hand somewhat to help with that narrow pinch. So what you're really seeing is the thenar muscles coming into play and helping bring that thumb in across the hand.
Right. So the narrower the pinch gets, the more it's thumb to pinky, which is the base of the thumb muscles, rather than the in between the thumb and the finger muscle, the adductor. We're now talking about the thenar muscles as they come across. All the common rock climbing hold types and the muscles responsible for being the main limiting factor. So the way to use this information is that for optimal training gains, you want to identify your weakness and then target your weakness, because you'll have the quickest, most effective gains going after those areas.
Well, I think that's coming up next.
The other way to use this information is to create a training program that avoids too much overlap between the muscle groups. In grip sport, they have 50 different gripping implements, but realistically, there's only 7 that we cover. There's only 7 functional flexors of the hand and forearm. If you're doing more than 7 exercises for grip, you're almost certainly being redundant.
You know, I think we've really focused on training gains, but I think what we haven't touched on is avoiding injury and making sure that you are actually strengthening the muscles that are important to your climbing helps avoid injury as well. So this really does a dual purpose.
But injuries keep you in business.
That's true.
What muscles am I using to kiss a Views with?